everyone, welcome to this week's Health by Ratio vlog, where we're going to be continuing on our topic on knee injury prevention and rehabilitation. And today we're going to specifically be going into how you can self-analyze and correct ankle immobilities that can be impacting that knee. The reason why this is so important and hopefully is going to be so useful for you guys is because often when we're dealing with knee injuries, we obviously have to go to physical therapy, especially when overcoming something like a surgery. And due to the often restrictions on physical therapy's length of time with a certain patient, like how many sessions they might be limited to with them, or also just because of how general and typical physical therapy is taught, we often see that so much of the time is spent on rehabilitating whatever the damaged tissue was in the knee, which obviously is needed to a certain extent. Like if you tear your ACL, you obviously have to strengthen up the ACL again so that it can take the traumas that you, or the forces that you need for it to absorb. But so much time is spent on that we neglect the joints above and below, or we do minimal work on the joints above and below. And often those are the main causes for why our injuries occur. We already talked about Gray Cook last week and how that impacts knee valgus. If you guys didn't get a chance to watch that video, please check it out. It explains a lot on why injuries occur, whether it's from the ankles or from the hips. So going into this week's topic with regards to the ankles, we talked about Claire last week and her tendency to go knee valgus. Well, another one of our clients that was dealing with a ACL surgery, grade 3 tear that they were recovering from, was Robert, who is a 60-year-old skier. And we started working with him because he had a surgery. He went a full calendar year after that surgery with not only doing physical therapy, but seeing chiropractors, going to masseuses, trying to do extra physical therapy. He just couldn't get it to work. And so he started working with our team of functional physical therapists and corrective exercise specialists. And we very quickly saw that one of the main reasons why he was having still so much trauma to the knee where it wasn't able to fully rehabilitate was because his ankles were lacking their proper mobility and stability. So a really easy assessment that you can do that we started off Robert with pretty early on into his program is your ankle dorsiflexion assessment. Now you can do this just against a wall, but because I don't have a wall with me, I'm going to use the foam roller right here. And it's easy to do. You're going to walk up so that you're going to have just one foot planted right with the toes up against the wall. Now, in an ideal world, you should be able to take the other foot, step back to the halfway marker of your instep. So your, like in this case, my back toes are even with the midline of my foot that's touching the wall. Then I'm going to just get myself positioned backwards wherever I'm relatively comfortable. And my goal is to try to touch my knee to the wall without raising my heel off the ground at all. So this can't come off. That's one of the things that we're paying attention to, and without the knee deviating from being in line with the toes. So as you're doing this, you want the knee to stay dead in line with the toes as opposed to it collapsing inward or having to shift outward to get there. Most likely it would be collapsing inward, or you might see the foot start to try to turn out to the side as you're going through this. So with Robert, when he was doing this, he wasn't able to get anywhere close to the mid-step. He was closer to the actual the metatarsals in his foot, so like kind of the ball of his foot was his position, and then he was able to just barely get there. Even still, he had a little bit of his heel coming off the ground. So this ankle dorsiflexion test, if you're having an issue with both ankles or even one more so than the other, that means that you're not able to, as you squat down, for instance, like Robert as a skier, or with Claire as a volleyball player, if you're squatting down to jump or you're squatting down as you're on the slopes, if you don't have the ability to go into dorsiflexion, you see this angle here with my shin relative to my ankle, then you're not going to be able to get into a full squat position and stay healthy there. So your body has to compensate. So we either have to stick the butt way back so that our shins are more vertical, which isn't very athletic, and that's going to waste a whole lot of force production. This was in part a reason why Claire was able to increase her vertical by so much. Or what we found with someone like Robert was he had the tendency for his feet to massively turn out so that he could cheat and get into that position, and that's what ultimately caused his ACL to go. So how we can correct that is by first mobilizing the calves, Achilles, and then the anterior tibialis. So the calves and Achilles are a pretty easy one. We're going to do this with first going into not releasing techniques and then a couple of stretches right after. So we want to make sure that the fascia, which is the connective tissue that runs in and around the muscles and is the densest, second densest substance in the body next to bone, we want to make sure that there's not any significant knots in and around the Achilles, which is right above the ankle, or scooting ourselves down more toward the calves and seeing if there's any knots around here. And you can tell if there's a knot by simply if there's pain involved with it. You should not have pain according to, not just according to, but an example of this is Kelly Starrett, who's a functional movement coach and wrote the book Supple Leopard. The textbook Supple Leopard, and actually quite a few other great textbooks like Deathbound and Ready to Run. He refers to, in terms of foam rolling and trigger point work that we're doing right now, there should be no pain associated to pressure on a muscle tissue. Now, obviously, if you're getting crushed like a car's crushing you, that's a different level of pressure, but reasonable amounts of pressure, there should be no pain associated to this. So for me, I have a little bit of tenderness here, so I'm just using my top leg to apply some extra pressure and tension into it, and breathing. The big focus is I should be able to consistently breathe the entire time while I'm going through this. If it's too painful and I gotta hold my breath, then I need to ease up off of this. Maybe I take my foot off, maybe I gotta reset, or if I feel like tingling or it feels twingy, or again, using one of Kelly Starrett's quotes, if it feels sketchy, it's sketchy. Get off of it, reset it, do something else. But I wanna really explore this. I wanna go more toward where my foot's turned out to the side and get the lateral gastroc or the outside of the calf. I wanna go more toward the inside, see if there's anything going on that angle. We're just trying to explore and really make sure that there's no areas that need some love. And the other thing that you can do after holding this for a period of time and after it gets a little bit, I should say, easier to breathe into it and relax into it, you can start pulling your toes up toward your shins and going in and out of dorsiflexion and plantar flexion. Plantar flexion is point down, dorsiflexion is pull up. But doing that is training the tissue there to still move the ankle while keeping this the fascia from knotting up and tightening up further. So that's one technique. You can do this with a foam roller. You can also do this with a lacrosse ball or with like a trigger point ball as well. It's just those are a little bit more intense. They're a little bit more acute, but it's your call. Some people need something a little bit more intense to really feel it. The next one we're going to get is your anterior tibialis. So this is your muscle in front of your shin that's actually in charge of pulling these toes up. Well, sometimes this guy, because it doesn't get recruited very often, it gets gunked up and knotted up, so it's not working very efficiently. So we're going to take something like our peanut here, a lacrosse ball, even the foam roller, and we're essentially going to position it underneath the side front part of our shin, and we're just putting pressure on that front right corner here. Now, I can scoot this up or down the entire outside of my leg, so I can explore this whole area to see if there's any knots into it. And once I find one, again, I can use this pull up and point down after I've been breathing into it for a period of time to really train that area of my leg to release. And now you can see what I'm doing here is I'm applying some pressure on top of this. If I want this to get a little bit more intense, if I feel like I need to get a little bit more love to it, I can use my top hand and apply a little bit more pressure. I can wiggle around on it. And we're trying to hold these knots, and I should have said this with the calf and the Achilles, you're trying to hold these knots until it feels like there's a release. So a release means it goes from that kind of sharp pain, that acute pain that you're trying to work through, to all of a sudden a nice dull ache, or it melts away completely. That shift from an intense pain down a couple of notches is an indication that your fascia knot just broke apart. Now that could happen in as quick as a minute, or that could take several minutes depending on how frequently you're releasing these knots and how knotted up that particular area is. So if it takes you several minutes, just work one knot. Like, you can work just one knot on that calf and then move on to the next leg. Otherwise, if you try to work if you're a runner, or if you're a skier like Robert, or if you're playing a sport that involves a lot of plyometrics like Claire, you're going to see that you have probably a whole lot of knots around here, because if you haven't been releasing this area, I should say, a whole lot of knots around here. So you want to kind of take your time with this, fully release just one knot, and then the next time you go at it the next day or the following day, release another knot. And as you do this over the course of a few weeks, it adds up and it starts getting quicker and quicker and quicker for those knots to release, where now instead of it taking 5 minutes to release, it only takes a minute to release. Now, after you've gone through a couple of those knot release techniques, it's time to stretch out a little bit. We're going to go into first just a calf stretch. You can do this by dropping your foot off of a step, or you can do it by planting your toes up onto something. So this could be up against a wall where you just move your foot to the corner of the wall, or I'm just using my foam roller here. And I'm going to move myself as close as I can to vertical, and with my knee straight, I'm going to feel a nice deep stretch into my calf. Now I can move a little bit in and out of this by just going into a little bit of a hip hinge position, almost like I'm trying to bend down to touch my toes. I'll feel this get a little bit deeper and a little bit shallower as I go up and down into it. And then after I've done that for about 20 to 40 seconds, I'm going to reset, bend my knee, and come closer with the knee bend, still keeping, again, that knee in direct alignment with the toes. I don't want to let the knee collapse inward like you might have seen when you were doing the ankle dorsiflexion test. But this knee bent position now, I'm going to be feeling a lot more tension in and around the Achilles itself. So it's going to shift a little bit lower, and I'm trying to focus on this position now. And then finally, what I'm going to do is get into a assisted or a banded variation. If you guys have access to this, I really like these as well. Right here I have a super band connected to an anchor point just about foot height here. And all I'm doing is walking out so that I have a fair amount of tension pulling me dead straight backwards. And then assuming you aren't fresh off of your ACL, MCL, meniscus, whatever it might be, injury, if you're able to take a knee here and you're able to bend into this, you can get yourself into the position of what we want to be able to be capable of when we're going into a deep squat. We're going to bend into this with the super band pulling us straight backwards. That kind of helps the ankle capsule open up a little bit more. And hold this for about 20 to 40 seconds. We can move in and out of it, and I can kind of push the knee more to the outside a little bit more. I can get the knee more dead direct straight ahead, or I could even move it a little bit to the inside, although we don't want to go toward the knee valgus too much. That's the area that we're trying to correct from. Then I can do the same thing facing the other direction. So if I get the band now wrapped around my Achilles, walk backwards, and go through the same thing where I move forward, still keeping this heel down onto the ground, and I'm bending into this, I'm allowing this super band to almost pull the back of the skin on my Achilles up, which is actually really important. Most people aren't aware, our physical therapists don't necessarily train us all the time, that the skin being gunked up makes a big difference in our mobility, because if this is locked up at the surface, it prevents the range of motion from the rest of the body. It would kind of be like taking my hand and pushing it through my shirt, and now it's taut. I won't be able to move as well as if my hand was more slack, and now I have a ton of range of motion in and around the joint. So going through this range of motion at the other angle is a really good practice as well with your super band. Now, after I've done these things, the final thing is to actually train our central nervous system on how to apply this to our actual athletic movement. So how do we get, like we did some great ankle mobility work, now we feel a little bit looser, but how do we actually train our ankles and the muscles around the ankles to move properly so that we actually are skiing better, we're jumping better, we're running better, where everything is firing the way that it should. Well, this is where we get a little bit more practical with regards to the exercise. So one easy exercise that I like to do right after is heel walks, trying to keep the knees straight and pull the toes up and walk around for anywhere from 20 to 30 steps until you start feeling a fatigue in the front of these shins. Another exercise that's really good to do is trying to hang out into a deep squat. Now, you're probably going to need to do this with some assistance. Like you can hold on to, for instance, a door frame and squat down, or a TRX band, or you could connect a super band to about chest height or above and hold on to your super band to help you down. All these things can work. I'm just going to use my foam roller here. But we want to make sure that we get ourselves in alignment first, which is very, very important. We don't want to hang out at the bottom of the squat in ugly form. We want to hang out in perfect form. So how we're going to do that is by getting your feet shoulder width apart, toes pointed forward. And we're going to most of the time we see people with the knee valgus issue, they have a tendency to collapse their arches. So what we're going to do is once we get feet pointed dead straight, no turnout. A lot of times I want you to actually look down. A lot of times our clients think they're pointed straight ahead. They're like, I am pointed straight ahead. I'm like, no, your right foot's turned out and your left foot's even turned out a little bit. Get them straight. Might feel a little pigeon-toed, but that's okay. We want it literally pointed straight ahead. Then what we're going to do is from the hips, we're going to screw the hips into the ground, almost like we're trying to twist two dinner plates in. This is what, we're not putting tons of tension into it, maybe like 10 to 20% effort, but what it does is literally pop up the arch and you'll feel tension shift more toward the outsides of your foot. Now you're not literally sliding your feet to the side, you're just getting a little bit of tension to kind of pop up that arch and get the ankle back into alignment. We don't want the ankles to be caving inward. We want the ankles and the Achilles to be literally straight up and down in line with the heel the whole time. So once we do that, we want to focus on hip tucking a little bit, and we're going to get more into detail on this next week and the following week when we're talking more about the hips and the segments above the knee. But we want to hip tuck to engage the glutes themselves, brace the core to keep us nice and solid, and then we're squatting down, trying to keep the knees more in line with the pinky toes as we go down. And so you can have something in front, like I said, something to hold on to, but you're squatting all the way down, and ideally you're hanging out at the bottom here, and you can kind of shift around a little bit, but the whole time you want to focus on the feet pointed straight ahead, those arches popped up. You want to be in a position where the knees are a little bit toward the sides and your back is upright. Now, if you hang out here long enough, you're going to feel that anterior tibialis start to fire up and get more and more activated, because basically you're trying to pull your toes up to keep you in this angle. So from a side profile, you're going into our position, core is tight, you're squatting down, the knees are in alignment, and you feel this angle the whole time that you're hanging out down here. And like I said, you could be holding on to something to kind of keep you a little bit more balanced and upright as you're going through it. So these movements are what are applicable to training us into how not only we stand properly, how we squat properly, how we jump properly, how we lunge and change directions properly. They give us not only the mobility, but the actual central nervous system recruitment to keep our foot and ankles in alignment. So stay tuned for next week, guys. Our vlog is going to be covering now above the knee, how to rehabilitate and functionally retrain that leg to stay in alignment and reduce those tensions on that knee.